Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. This is a continuation of the adult health assessment and we will be reviewing the head and the neck. Now, 4 clinical manifestations related to anomalies associated with the head and neck are things such as headache, swelling, edema, neck stiffness, dysphagia, difficulty swallowing, a sore throat, and enlarged lymph glands. So when it comes to the physical assessment, when we look at the head and neck, it's important to remember that the head performs a variety of functions such as chewing, mastication with the mouth, vision, which is to do with movements of the eyes, smell, breathing, the nose, the ears, hearing, the forehead generates facial expressions. The neck is the pathway between the head and the rest of the body, and it contains the proximal esophagus, the trachea, the thyroid gland, and the parathyroids. And also it provides vessels that permit blood flow to the brain and the head and away, the carotid arteries, the cerebral arteries, the superior inferior vena cava in the form of the jugular vein. It also transmits nerve signals from the brain to the rest of the body via specialised nerve pathways, and it supports the head. The neck supports the head, the weight of the head, and it also protects nerves that carry sensory and motor impulses from the brain to the body and from the body to the brain. The neck also allows the head to turn and flex in most directions. When it comes to history, it's important we take note of family history again. And questions could be, do you have a family history of thyroid problems? If yes, who had the illness? Was it hypothyroidism or hyperthyroidism? And when did the person have it? How was it treated? And what were the outcomes? When it comes to history, in respect to the head, this could relate to headaches, which could be as a result of anxiety, stress, alcohol consumption, eating processed meats, lack of sleep, poor posture, fasting, certain conditions such as sinusitis, a tumour, some injury, which could have been concussion, or a history of hypertension and ear infections. When it comes to the neck, there could be a history of pain, which could be related to getting older, aging, which could include cervical spondylosis or arthritis, poor posture, muscle strains, worn out joints, nerve compression, herniated discs or vertebrae, injuries, and diseases such as rheumatoid arthritis, meningitis, or even cancer. Past history is always important, and questions could include things such as, have you ever had an accident that resulted in a head injury? Have you ever had an accident that resulted in loss of consciousness? Then you can be using certain issues that relate to protective equipment, such as, do you wear a seatbelt when you are in a car? Do you wear a bicycle helmet when riding a bike, whether it be now a pedal bike or a motorbike? Medication history is always important, And questions could include such things as, do you take any regular medications? Do you drink alcohol? And if so, how much alcohol do you drink? Do you take any over-the-counter medications, which could include herbal products? Then lifestyle behaviour history is important as well. So how do you sleep? Do you drink water? Do you eat healthy or exercise? There are other questions which you can rate here, as I have on the side there, in relation to lifestyle behaviour. Things like alcohol consumption, processed foods, cigarette smoking, exercise, fasting, physical activity. Lifestyle behaviour history is important in all of the systems. So when we look at physical assessment, again we have subjective data and objective data, and both the assessments ask questions. So things could include such as, are you currently experiencing any pain, lumps or nodules? And explain where. Have you ever been diagnosed with anxiety or a stress disorder, a head injury, concussion, hypertension or thyroid problems? This requires the patient to explain. Or you could look at objective assessment, which is inspection. An inspection could identify issues related to the head and neck, lesions. You could palpate those lesions, and you may actually auscultate those suspected lesions, which could determine things like a bruit in the carotid arteries. Palpation may determine whether you have tenderness. Inspection will be the initial, what you see is what you know. Inspection then of the skull and the neck, we have the skull is typically round, oval, without any obvious deformities. The facial features are symmetrical and of the appropriate size. The nasolabial folds are symmetrical. What you see is what you know to be normal. So you could be examining the hair and the scalp, and if so, if there's any concerns here, the nurse or the healthcare provider should wear personal protective equipment such as gloves, especially if there's a possibility of contact with an open sore or lesion. You'd be looking at hair distribution, quantity of hair, texture of the hair, and cleanliness. And this can be from the forehead to the base of the cranium to the top of the ears. Then observation of the neck. And this involves looking at the sternocleidomastoid muscles for symmetry. Determining now whether the thyroid and the thyroid isthmus is identifiable. Typically not. But again, you're determining whether there are any lesions, swelling, edema, pulsations, just with your observation, and observing whether the trachea is midline. When it comes to palpation of the head and neck, typically you would begin to palpate the temporal artery, which is above the cheekbone near the scalp line. And the normal pulse grade for all pulses is typically 2 on a 4-point scale, which means it's normal and easily identifiable and not easily obliterated. With palpation, you can also palpate the thyroid gland, and typically the thyroid gland is not detectable, but if it is, it's smooth, rubbery, non-tender, symmetrical, but barely palpable beneath the sternocleidomastoid muscles. And you can use the anterior approach, or you could use the posterior approach. Palpation also involves systematically palpating the facial and neck lymph nodes, and the usual order of the examination is preauricular, preauricular being before the ears, and postauricular being behind the ears. And the pads of the second and third and fourth fingers are used to gently palpate with small circles and varying amounts of pressure over each lymphatic region. However, typically no lymph nodes are normally palpable in the adult. If a node is palpable, you should describe the following characteristics. Where is it? The location in which lymphatic chain? The size in millimeters or centimeters? The consistency. Is it smooth, soft, non-tender? Mobility. Normally, they're freely movable. Delimitation basically means normal demarcation of nodes, so they're in a confined area. They're not spread over a large area. When it comes to auscultation, if the thyroid gland, for example, is enlarged, a goiter, either unilaterally or bilaterally, you auscultate over each lobe for a bruit. And a bruit is an abnormal sound that typically you don't hear with a stethoscope. But if you are auscultating for a bruit, you use the bell of the stethoscope, but normally there is no bruit, there are no vascular sounds when you auscultate an artery. So normally you won't hear anything, but a bruit is an abnormal sound that you hear with a stethoscope, and it's typically a swishing sound. So swoosh, 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 with each palpation or beat of the heart. Okay, so when it comes to the clinical manifestations related to head and neck, common signs and symptoms are going to be headache, pain, which could be facial or neck pain. It could be things like lumps or masses and other issues that relate to specific disorders. So when we look at the headache, we describe that. You can either use the PQRSTU and decide whether it's acute or chronic. Facial pain can be recognised by facial grimacing. When it comes to neck pain, you would be asking, where is the pain? Is it acute, sudden, or is it chronic, ongoing? In respect to lumps and masses, where are they located? And do these lumps have pain or tenderness, or are they pain-free? And they could be associated with conditions like thyroid conditions, tracheal conditions, esophageal conditions. And that's why I have over there. So for example here, if you're suspecting hypothyroidism, why would that be an issue with head and neck? Because you can develop a goiter. And you can develop a goiter whether it's with hypothyroidism or hyperthyroidism. What's a goiter? A goiter is an enlargement of the thyroid gland. And you will see that as neck swelling, which could compromise their breathing. So I say, why could it compromise their breathing? Because this can cause now obstruction of the trachea. And that might be an issue. Why might that be an issue in relation to swallowing, difficulty swallowing, which we call dysphagia? Why might that be an issue? Because the thyroid gland, if it becomes enlarged, being a goiter, can obstruct your food passage, the esophagus, or your breathing passage, which is your trachea. Certain disorders related to the head and neck could be a CVA, cerebrovascular accident, also known as a stroke. And a stroke is a common cause of acute facial paralysis, and it involves the brain. And if you want to determine whether the patient may have had a stroke, you could ask the patient to smile or show their teeth. And as you can see by the image, it's asymmetrical. The affected side is the left side, which indicates possibly that this man has had a right-sided CVA. Here we can look for CVA. There's typically upper face paralysis. Note the eyebrow and the forehead. But this occurs rarely. When we look at other disorders of the head and neck, this could be Bell's palsy. And Bell's palsy is a common cause of acute facial nerve paralysis, which affects the seventh cranial nerve, which is the facial nerve. It doesn't involve the brain, but again, you could ask them to smile and show their teeth. And what typically could happen is the upper face paralysis, eyebrow and forehead are affected. Have a look at the image. And this occurs almost always with Bell's palsy. Other conditions, disorders that affect the head and neck could include a disorder called acromegaly. And acromegaly just means everything gets bigger abnormally. And this is as a result of an overproduction of the growth hormone in adults and results in thickening of the skin, the subcutaneous tissues, thickening of the facial bones, and coarsening or having hard facial features. Have a look at the images, and there's a gradual progression over 10 years in relation to changes that occur. Another disorder which affects the head and neck is Parkinson's disease. And the head and neck signs of this degenerative neurological disease include a mask-like facial appearance with rigid muscles. Myxedema, which is related to hypothyroidism, can affect the head and neck, especially with swelling edema of the face, as you can see with the image. And yes, you can get alopecia, hair loss. In relation to the neck, here you can develop a goiter, which can obstruct your airway, and you may have difficulty swallowing. But with severe hypothyroidism, called myxedema, there's periorbital swelling around the eyes and edema of the face. Another common disorder related to the head and neck could be Cushing's syndrome, which occurs as a result of hypercortisolism, and this is when the body makes too much cortisol. And this can result in skin disorders such as acne or weight gain, noticeable in the head as a moon face, and certainly in the neck, shoulders, a fatty lump that occurs called a buffalo hump. Swollen, moon face, neck swollen, a buffalo hump as a result of weight gain, a fatty lump deposition as a consequence of hypercortisolism or too much cortisol production. Cushing's syndrome. Another disorder, as we've mentioned previously, could be an enlargement of the neck as a result of an enlarged thyroid gland. And this can occur with hypothyroidism, which in previous Manny learn chops is Graves' disease or thyrotoxicosis. Or it can be the result of hypothyroidism, underproduction of thyroxine, also known as myxedema. The enlargement can compress the structures in the neck, such as the trachea, breathing issues, esophagus, swallowing issues, and even blood vessel issues, compressing things like the superior vena cava, the jugular veins, the carotid arteries. even the blood vessels associated with the thyroid gland. Questions that you could be asking about facial pain, for example, are where exactly is the pain? How long have you had it? On a scale of 1 to 10 or 0 to 10, how bad is it? Can you describe the pain? What makes the pain better or worse? What is your pain goal? And you can use the PQRST acronym. You can use the cold SPA acronym. You can use the old CARTS acronym, which we've mentioned in other Learn Shops. Questions that could be asked in relation to headache or facial pain could include the following. Have you had any unusually frequent or severe headaches? If so, where? Does it go anywhere, radiate? Is it on one or both sides? Can you describe what the headache feels like? And if you could, on a scale of 0 to 10, with 0 being no pain and 10 being the worst, where would you rate your pain? When did it start? How long has it lasted? How often does it occur? Do you ever have milder headaches? What makes it worse? What makes it better? What brings it on? Is there any relationship to food, alcohol, smoking, activity, menstruation? Do other symptoms accompany this pain? For example, nausea, vomiting, visual changes, an aura of some kind. Questions that could relate to neck pain could include, where exactly is the pain? How long have you had it? On a scale of 1 to 10, how bad is it? Can you describe the pain? What makes it better? What makes it worse? What is your pain goal? And again, the tools that you can be using could be the PQRSTU acronym, cold SPA, old CARTS. Even here, you could be using the Wong-Bakker, the facial images that you can see, with 0 being no pain and 10 being the worst possible pain. Other questions could relate to not being able to move your neck enough, limited neck movement. You could ask, for example, are you having any difficulty turning your head, your neck? Are you having any difficulty flexing your neck or extending your neck? Because these could allude to osteoarthritis, rheumatoid arthritis, other inflammatory disorders or injuries. Questions could involve lumps or masses. Have you noticed any lumps or masses on your head? Have you noticed any lumps or masses in your neck? If so, how long have you had this lump? How many lumps are there? How large are the lumps, if you have any? Are the lumps changing? Are they tender or are they painful? When it comes to questions related to specific disorders, such as hypothyroidism, Graves' disease, you could ask, do you have any of these symptoms? And that may give you information about whether they may have this disorder. Are you fatigued? Are you ever hungry? Have you had any unintentional weight loss? Are you anxious? Do you have palpitations? Do you have a rapid pulse? Are you heat intolerant? Is your hair normal? Or have a look. Is the hair fine or limp? Are they sweating? Do they have muscle weakness? There are certain other indications as far as signs go, things like the goiter or the bulging eyes, which are commonly associated with hypothyroidism. Questions can also relate to identify things like hypothyroidism. So questions could be related to symptoms. Are you fatigued? anorexic, cold intolerant, have dry skin? Looking at their hair, is it brittle or coarse? Do you have any menstrual irregularities if you're a female? Is there any unintentional weight gain? Do you have difficulty losing weight? What is your libido in relation to your sexual appetite like? Okay, that's the end of this session. Thank you again. If you felt that this Learn Shop was of any benefit, please recommend it to your colleagues or your friends and subscribe so that you'll be notified of any new Dr. Manny Learn Shops. Thanks again. God bless.